Welcome. Today we're going to speak about non-communicable diseases. By the time you finish this session, you should be able to speak comfortably about the burden of non-communicable diseases, which we'll call NCDs, who is most affected by NCDs, the key risk factors for such diseases, and measures that can be taken to reduce the burden of non-communicable diseases. Let me begin with two very brief vignettes. Hui Li is a 60-year-old woman in Beijing, China. She has smoked since her youth. Beijing is a very polluted city. Hui Li suffers from chronic obstructive pulmonary disease, has great difficulty breathing, and is on oxygen permanently. Jose lives in Guatemala City, Guatemala. Jose's diet is mostly carbohydrates. He gets little exercise, and he's been eating very salty food for a very long time. Jose is overweight and suffers from high blood pressure, which is usually referred to as hypertension. And with the help of our students, let's look, before we go any farther, at some of the key terms that will help us to explore further the concept of non-communicable diseases in cases like Hui Li and Jose. Rachel, what's an NCD, or what's a non-communicable disease?
A non-communicable disease is a disease that can't be spread from person to person.
And Vivek, can you give me an example of, several examples,
Sure.
if you would, of non-communicable diseases?
Diabetes, hypertension, heart disease.
Diabetes, hypertension, heart disease. And Shaylin, as countries so-called develop, become wealthier economically, what happens to non-communicable diseases as a share of the total burden of disease?
As countries develop, the amount of people who may suffer from non-communicable diseases increases, and the number of people who may be susceptible to communicable diseases will decrease.
And the share of non-communicable diseases in the total burden of disease we expect will go up as countries become so-called better developed or wealthier. Now, when we think broadly about non-communicable diseases, there are a number of key points that I'd like everyone to keep in mind. The first is that non-communicable diseases constitute the largest share of deaths and DALYs in all regions of the world except sub-Saharan Africa. The next is that in low and middle income countries, non-communicable diseases as a share of total deaths and DALYs is growing as they go through what we've called this epidemiological transition, as they get better off and begin to suffer more and more of the so-called lifestyle diseases. And in fact, many of the risk factors for the non-communicable diseases relate to lifestyle. In addition, some non-communicable diseases can be prevented at relatively low cost, but yet they can be very expensive to treat. And finally, when we think about NCDs and low and middle income countries, it's especially important to note that non-communicable diseases are exceptionally important in low and middle income countries, given their burden, the relatively young ages at which people are afflicted by them, and their often substantial health and economic consequences. Let's explore these points further with the help of the website from the Institute of Health Metrics and Evaluation. We're going to look first at the distribution of the burden of deaths, the distribution of the burden of deaths by Group 1, Group 2, or Group 3 disease. Group 1 is communicable, perinatal, and nutritional and maternal. Group 2 is non-communicable, and Group 3 is injuries and accidents, or injuries, excuse me. With the help of the website of the Institute in Health Metrics and Evaluation, let's first explore non-communicable diseases as a share of deaths and DALYs for selected groups of countries and for one region. So here what we see is we're looking at low and middle income countries, both sexes, all ages for 2013. And what we see is that when we look at the share of total deaths represented by non-communicable diseases by communicable, perinatal, nutritional, maternal conditions, and by injuries, what we see is that almost 64% of the total deaths can be attributed to non-communicable diseases. When we look at the group 1 causes, we'll see that it's about 27%, and when we look at injuries, we'll see that it's almost 10%. When we shift this view now to looking at the higher income countries, what we'll see, as we would anticipate, is that the burden of deaths in high-income countries can be overwhelmingly attributed to non-communicable diseases. And here, in fact, about 88% of all of the deaths can be attributed to non-communicable diseases. The group 1 conditions cause only about 6% of deaths, and injuries about 7%. And now let's look at one of the poorest regions of the world, and that's sub-Saharan Africa. Also, deaths for both sexes, all ages, for 2013. And here what we'll see is a really different picture. When we look at non-communicable diseases, they make up only about 31% of deaths. When we look at communicable, neonatal, perinatal, and nutritional conditions, they're about 62% of deaths, and injuries are about 7% of total deaths. So when we're considering deaths, what we see is that for low and middle income countries and for high income countries, the overwhelming majority of deaths can be attributed to non-communicable diseases. But we'll also see is that the only region of the world in which communicable causes or group 1 causes continue to be the largest cause of deaths is sub-Saharan Africa. Now let's look at the distribution of DALYs across the same 3 groups of countries. Let's start with the low and middle income countries. And now we're looking at DALYs for both sexes, all ages, 2013. And it looks a little bit different than did the view of deaths. What we see here is that non-communicable diseases constitute about 53% of the DALYs can be attributed in this low and middle income countries to non-communicable diseases, about 36% to the group 1 causes, and about 10% to injuries. Now let's look at the high income countries. And we'll see a view quite similar to what we saw in deaths. And here what we see is about 85% of the DALYs can be attributed to non-communicable diseases, only about 6% to group 1 causes, and only about 9% to injuries. And let's conclude this view by looking at sub-Saharan Africa. And here what we'll see is about 27% of the DALYs can be attributed to non-communicable diseases. The overwhelming proportion, or about 66%, can be attributed to group 1 causes, and about almost 7% to injuries. So both for deaths and for DALYs, it's really essential to understand that in all regions except sub-Saharan Africa, the overwhelming majority of deaths and DALYs can be attributed to non-communicable causes. But in sub-Saharan Africa uniquely, the largest share of deaths and the largest share of DALYs continued to be attributed to group 1 causes. Now what we're going to do is look at the leading causes of death, both globally and for countries in the different World Bank regions, for all ages, both sexes, for 2013. And here we've clicked on the world as a whole, the global view. And when we look at the global view, what we see is the leading causes of death are ischemic heart disease, cerebrovascular disease, chronic obstructive pulmonary disease. I'm just going to name those that are non-communicable: Alzheimer's, lung cancer, and diabetes. So when we look globally, what we're seeing, in fact, is that 7 of the 10 leading causes of death for all ages and both sexes in 2013 were in fact non-communicable diseases. And now let's do the same thing but for DALYs. And here again we'll look at the global view. You can look yourself and dwell if you like on the view for different World Bank regions. When we look at DALYs, what we're going to find is a very similar result, but some of those causes that don't lead to much death but do lead to substantial disability will also now become important in our list of top 10. So here when we look globally, what we see is ischemic heart disease among the non-communicable causes, cerebrovascular disease, low back and neck pain, chronic obstructive pulmonary disease, and depressive disorders. So I think it's 6 of the top 10 when we look globally in terms of DALYs are also non-communicable causes. Again, highlighting the exceptional importance of non-communicable causes. And I say this partly because many people, including people like myself who've worked in this field for a long time, grew up working overwhelmingly on communicable diseases in low resource settings. And for some people, it's difficult to appreciate the exceptional importance of non-communicable diseases, not only in high and middle income countries, but even in low resource settings, as we'll talk more about. So let's look now at the leading risk factors for deaths in low and middle income countries, high income countries and globally for 2013, taken again from the IHME data. This is divided by country income group and globally. And let's look at the global. And here what we see is very much what we would predict. Knowing the importance of non-communicable diseases to both deaths and DALYs, we would expect to see the risk factors that help lead to those diseases. And indeed, what we see is high blood pressure, smoking, high body mass index, obesity, high fasting plasma glucose, high sugar, high sodium diet, low in fruit, ambulant particulate matter, outdoor pollution, indoor air pollution, total cholesterol, and alcohol use. And in fact, when we look at the 10 leading risk factors for deaths, globally what we see is all of them, in fact, relate to non-communicable diseases. Now, I also want to highlight 3 matters of exceptional importance concerning the way in which non-communicable diseases play out in today's low and middle-income countries. First, it's really important to understand that non-communicable diseases often affect people at younger ages in low and middle-income countries than they do in high-income countries. Second, probably we can say most low and middle-income countries today have less ability to prevent, to treat, and to control non-communicable diseases than today's high-income countries have. And therefore, it shouldn't be a surprise, but it should sadden us that non-communicable disease death rates are higher in today's low and middle-income countries than they are in high-income countries. And this further highlights the importance of countries at all income levels of paying greater attention to the burden and the growing burden for low and middle-income countries of these non-communicable diseases. Now, it's also important to consider how the burden of non-communicable diseases is likely to evolve. We should anticipate that the importance, as I've alluded to already, that the importance of non-communicable diseases in low and middle-income countries will grow. These are populations that are aging, they're countries that are developing, and there are forces of globalization and internal forces as well that are leading to changes in lifestyle and diet, all of which will contribute to giving non-communicable diseases in the future a greater prominence among the total burden of disease than they have now. It's also really essential to understand that non-communicable diseases already cause enormous economic costs, and in the absence of addressing them effectively, these costs are going to grow. So let's look at the results of just a very small sample of studies. There's been a lot of work looking at the economic costs of non-communicable diseases in high-income countries, but relatively little work on the economic costs and consequences of non-communicable diseases in low-income countries. There have been, however, recently a number of studies that did look at NCDs in low and middle-income countries, and let me just highlight the results of 4 of them. One suggested that between, I think, 2015 and 2030, India could face $6 trillion and China $30 trillion of economic losses attributable to the burden of non-communicable diseases. Another suggested that when one looked broadly between 2006 and 2015 at the 23 different low and middle income countries, that they would face $84 billion of economic losses attributable to NCDs. Another study suggested that these countries could lose between now and 2030 about almost $50 trillion. And there's an interesting study of the Eastern Caribbean that highlighted the fact that these non-communicable diseases were costing families up to 36% of their annual family income. Now, let's talk, before we end, about what can be done. The World Health Assembly, the governing body of the World Health Organization, endorsed in May 2013 a global NCD action plan that would cover the years 2013 to 2020. The plan included a set of voluntary targets. These are especially valuable to note because of the way in which they're organized. Some address mortality and morbidity, some behavioral risk factors, some biological risk factors, and some the ways in which national systems could respond. And these targets, for example, included a 25% relative reduction in the overall mortality from cardiovascular diseases, cancer, diabetes, or chronic respiratory diseases, at least a 10% reduction in the harmful use of alcohol, a 30% relative reduction in the prevalence of current tobacco use in persons 15 and over, halting the rise in diabetes and obesity, reducing the risks from high blood pressure, and trying to ensure in a systems response that at least 50% of the eligible people receive drug therapy and counseling to prevent heart attacks and strokes, and that about 80%, there should be 80% availability of the affordable basic technologies and essential medicines to deal with the most important non-communicable diseases as well. The Global Action Plan also proposed some specific measures that might be taken to help to achieve these targets. And this graphic shows you some of the most important, a selected number of these policy measures from the Global NCD Action Plan. One was to put tobacco use in a very prominent place and take a set of relatively well-known and well-documented measures to reduce tobacco consumption, including taxing to reduce affordability, creating smoke-free environments, banning advertising and promotion of cigarette smoking, and promoting individuals' cessation from cigarette smoking. And I have to say here, if we're going to reduce non-communicable diseases, so many of which relate to tobacco consumption, it's going to be imperative to help present smokers quit, as well as ensure that new people don't start smoking. Harmful use of alcohol, it was suggested that, like in tobacco, affordability be reduced through increasing excise taxes, sale hours be restricted as you would restrict sales to minors. And you can see for yourself here a number of other measures oriented toward addressing physical activity and unhealthy diet, reducing cancers through immunization for cancers which are related to infectious causes like cervical cancer and human papillomavirus, and liver cancer and hepatitis B. And finally, trying to address cardiovascular disease and diabetes more effectively through drug therapy and counseling to high-risk individuals and aspirin for heart attack. NCDs are a very broad topic. Hopefully you now understand better than you did before the importance of non-communicable diseases as a share of total deaths in all regions of the world, the importance of non-communicable diseases as a share of DALYs in all regions of the world, and how they predominate in all regions of the world except sub-Saharan Africa, where they are growing in importance. You also understand that this growth will probably continue as a result of a variety of forces such as urbanization, globalization, improving economic status, and changes in lifestyle and diet that are occurring in many countries. Of course, the aging of populations will also have a substantial impact on the growth of the burden of non-communicable diseases. We also know that the world has now collectively thought about what might be done, and it's been suggested through a global non-communicable disease action plan that there be certain targets, and there are certain specific, well-known, cost-effective measures that ought to be doable and sustainable in a wide range of settings to make more progress in reducing the burden of non-communicable diseases. And some of these diseases as well can actually be addressed by attacking their infectious causes through immunization. In the next session, we'll pick up on this and speak further about cancer and diabetes.